Clonazepam, common brand names Clonazepam or Retrovir. Retrovir or Clonazepam can be described in a tablet. You want to always swallow the tablet whole with water when taking this medication. It can be taken with food or without food. Clonazepam can be prescribed in a 1 to 2 milligram per day. The lowest dose can be 0.5 milligrams to 1 milligram. It can take an increase to 2 to 4 milligrams per day, and the maximum per day dose is 20 milligrams taken throughout the day. You can be described an injection. The doctor will administer this as what you need to take and how you will take this. You want to always consult with your doctor before taking this. If you have been prescribed drops, the most common drops prescribed is 10. However, it's just whatever your doctor prescribes. This will mix with water as well and taken. Clonazepam is under the class of anticonvulsants benzodiazepine, which slow down the brain activity. You want to always consult with your doctor before taking this medication with any other medication such as Tylenol or any other antidepressants or psychotics. The clonazepam is a medicine used to treat seizures and panic disorders such as social phobia and muscle cramps and epilepsy. It is in the DEA class of a Schedule 6, which makes this medication very addictive. If it's used over several weeks, it can increase the risk of becoming dependent on the drug, causing withdrawal symptoms. And if you're having any of these symptoms, you want to tell your doctor and consult with your doctor of what's the next best step to do. If they get too severe, you want to go to the emergency room. Clonazepam, as I said, is being abused and misused because of how such of a high drug it is, and if it's taken with any other drugs, it causes higher side effects such as dizziness or drowsiness. You can always use a specific dose your doctor give you. The dosage can differ because of the specific symptoms you're having or the severity of the symptoms, side effects you're having. But there are some guidelines, as I said, for taking this medication. Some common side effects are slurred speech, difficulty in concentrating, slow thinking, memory problems, impaired coordination, double vision, muscle weakness, balance problems, and dizziness. The most uncommon side effects which affect 10 and 30 people are drowsiness and fatigue, and the very rare is nausea and diarrhea. You want to always avoid drinking alcohol with this clonazepam because it can increase the side effects, as I said, with confused or dizziness. And you want to be very careful when driving a car or heavy machinery because it can cause you to be dizzy as well, making it very hard to see or drive and causing you to be confused. Clonazepam has an FDA warning of fatal respiratory depression, so you always want to monitor a patient's respiratory when taking this medication. And as always, if you're pregnant or breastfeeding, you want to consult with your doctor because of the common side effects of clonazepam. And my cited sources are pdr.net, David's Dry Book, and